We've all heard how state budget cuts could affect our schools. Now we're focusing on another potential impact, home health care services, which more than 36,000 people across our state rely on.
Without this program, we could see spikes in folks going to the emergency room if they try to stay at home on their own due to falls, medication mismanagement.
But state lawmakers are planning to cut $49 million from the Medicaid Personal Care Services Program. Fox 8's Roxana Haynes joins us live now in Greensboro. Roxana, thousands of jobs are on the line too, I understand.
There are more than 20,000 home health care aides who could potentially lose their job if the state cuts funding to the services they provide. We visited a home health care patient today who says without his aide, he wouldn't be able to live in his home. Every weekday for 2.5 hours, Pat Fields spends time assisting 61-year-old James Thomas.
Where I get money.
Suffering from cerebral palsy, Thomas has a hard time doing simple household chores, which is where Pat Fields comes in.
I feel like my clients should be able to enjoy their home as long as they can.
Fields checks on Thomas's health, cleans up the house, prepares a meal, and reminds Thomas to take his medicine.
We are their lifeline to independence in the home.
Bayonne Nurses Division Director Shannon McCarson says this type of service would disappear if the state's proposed budget cuts become reality.
When we talk about 20,000 home health aides that could be out of work, that could be a tremendous burden to the state unemployment crisis as it is.
Home care specialists say their services are more cost effective. The Medicaid program costs $750 per month. Compare that to facility-based care, which on average can cost $1,700 to $3,000 a month. For Thomas, it's the quality of life and comfort of familiar surroundings.
I get in the bed, being in the because I've been there all my life.
McCarson also worries if the program goes away, families of these clients will be faced with tough decisions.
They may have family members who would have to quit their jobs in order to stay home to keep them at home, which just kind of transfers the financial burden to the state. Unemployment, somebody else picking up Medicaid.
Governor Bev Perdue proposed a more modest $14 million cut to the program in her budget. Now the future of the home health care program is in the hands of state lawmakers, which advocates are hoping cuts will be much less than the proposed $49 million.
You have a good afternoon, and I'll see you tomorrow.
Home health care advocates say if the state cuts funding, they'll lose federal match money too. Overall, program directors say if the proposal passes, they'll lose about $160 million. Live in Greensboro, Roxana Haynes, Fox 8 News.
Thank you, Roxana. Until now, the General Assembly is focused on cuts to close the $4 billion budget gap in North Carolina. But critics say it's going to take more than that to get the job done. They say it's going to take higher taxes. Governor Bev Perdue wanted to focus those taxes on specialty items like alcohol and cigarettes, but some lawmakers think that can't raise enough money either, which means we could all be paying up if lawmakers decided to raise the sales tax or income taxes. Right now, the House budget does not include a tax increase. Today, Governor Perdue released a statement saying, with North Carolina facing an unprecedented budget shortfall, I call on House members to utilize a combination of spending reductions and new revenue in their budget.